The federal government has announced new quarantine rules for Australians who've been in South Africa and several other countries over concerns about the new Omicron coronavirus variant. Effective immediately, non-Australian citizens who've been to those nations cannot enter Australia. Political reporter Stephanie Boris joins us now from Parliament House. So, Steph, the federal government has announced a raft of changes. Just take us through the detail.
Well, today's announcement follows what a number of other countries have done in terms of banning flights from South Africa because of this new variant of concern. Here in Australia, there are several changes being made, so I'll run those through with you now. The first is that if you're an Australian citizen or permanent resident and you've either been in South Africa or 8 surrounding nations, which include Botswana and Zimbabwe, you will have to quarantine for 14 days. Now, New South Wales, Victoria and the ACT at the moment, if you're fully vaxxed and you're overseas, you can come back without having to quarantine. That will change if you've been to one of those nations. As to where you quarantine, that's still being worked out at the moment. The government's saying it's supervised quarantine, so we potentially could see a mixture of both hotel quarantine and home quarantine there. If someone has come into Australia in the past 14 days and they've been in one of those countries, they are now required to isolate immediately and get tested. We understand that health authorities across the different states are trying to get in touch with different people to check in on them. Now, if you're not an Australian citizen or not an Australian permanent resident, you will no longer be able to come into the country. Effectively, that is a ban. That also does include international students and skilled migrants who were told that from the 1st of December they were allowed into certain eastern states if they were fully vaccinated. So having to take a step back there now, given this new variant of concern. Flights have also been banned from South Africa and those surrounding nations for the next 14 days. So these have all come into place because of this variant of concern. On top of that as well, we're seeing a change to the way that the border application process is filled out when you come back into the country, no matter where you come from. So at the moment, you have to show you're fully vaccinated and you also have to show that you've had a PCR test in the past 72 hours. On top of that now, you will have to list where you have been in the past 14 days, all of those countries. And that, of course, is an attempt to ensure that anyone that's been in South Africa or all those surrounding nations will be identified and notified to authorities.
And Stephanie, how many people will this now affect?
So we asked that of the Chief Health Officer, Professor Paul Kelly, today. He says that it's less than 100 Australian citizens and permanent residents that have arrived sort of over this month and that will be affected in terms of having to isolate now. Those that, of course, we're expecting to come back in the next few weeks, well, that number is unknown at the moment. What happens next, though? You know, these precautions have been put into place now. The question is whether that is enough or it's too harsh. We spoke to the Health Minister, Greg Hunt, today. He says that in terms of what measures could come next, it could go either way.
I said yesterday, if more actions are required, we will not hesitate. Today we have taken those actions. Today I'm saying if the medical evidence shows that further actions are required, we will not hesitate to take them. And that may involve strengthening or expanding the restrictions. It may involve reducing the restrictions and the temporary measures which we've put in place. The world will learn a lot over the coming weeks. And what we've done is make sure that no person who has been in the 9 Southern African countries can enter Australia unless they're Australian citizens, residents or dependents. And if they fall into that category, they must have 14 days supervised quarantine.
Greg Hunt there. Now, Steph, of course, this is all about the new variant of concern, Omicron. Have we had any cases detected so far in Australia?
Not at this stage, no. However, there was a repatriation flight from South Africa in recent days, and we were told today that one person has tested positive to COVID-19, but we do not know which variant that is yet. So today's announcement about all the quarantine changes is an attempt to try and stop this variant coming into the country, given what we saw with Delta in the past as well. There are still, though, a number of questions about this variant. It's really early days, and the Chief Health Officer, Professor Paul Kelly, says experts are still trying to determine exactly how this variant spreads through the community and the severity of it as well.
What do we know about this virus? We don't know a lot about it, to be honest. We know we have the genomic sequence. We know that there are mutations within that genomic sequence. What those mutations lead to in terms of clinical efficacy vaccine efficacy, the ability of the public health social measures and so forth to keep control. We don't know that yet.
Now, while there are still many questions to be answered, one message is very clear. Health authorities and the federal government urging Australians, if they're not vaccinated, to make sure that they get that jab as soon as possible.
Political reporter Stephanie Boris there with the latest in Canberra.